Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Clinical significance of different casts. We have different casts present in the urine. First, we have hyaline casts. Hyaline casts are present as they are the normal constituents of the urine. These are present normally in the urine and they have no attached or no other significance is absent in hyaline casts. In the hyaline cast, one of the important thing is presence of Tom Hirschfeld proteins. So these Tom Hirschfeld proteins are the proteins which are secreted. These are actually secreted by the epithelial cells of loop of Henle, and these are excreted as hyaline casts. Hyaline casts are nothing but the epithelial cells of the loop of Henle secrete Tom Hirschfeld protein, which is excreted as hyaline casts. So hyaline cast is a normal constituent of urine with no attached significant, and it contains Tom Hirschfeld protein.
thank you and thank you for watching.